My name is Mark Shelhamer. I'm a professor at the medical school at Johns Hopkins University in Baltimore, Maryland. I'm here under NASA auspices carrying out a research project that they are funding. And my colleague Michael Schubert is here with me. We're both professors at the School of Medicine. Everyone has a vestibular system on both sides of the head. So you've got a set of sensors over here and a set of sensors over here. And one part of the vestibular system, called the otolith organs, detects gravity. And this, of course, is of great interest to us because when you go into space, you mess around with the gravity level. And in particular, we don't know for sure if behavior that is moderated by the vestibular system, influenced by the vestibular system, will be the same in a lunar gravity environment or a Martian gravity environment as it is in an Earth-based gravity setting, 1G, or in a 0G setting in space. So the flights this week are looking at the intermediate gravity levels between 0 and 1. So we use a virtual reality headset, standard off-the-shelf headset, no modifications. That's very useful because the tests that we perform need to be done in darkness so that both eyes don't see the same thing. Because if both eyes see the same thing, that provides very strong cues to align the eyes. So I'm going to describe vertical alignment, and then there's also torsional roll alignment. One eye sees a horizontal line like this, the other eye sees a line like this. They're randomly offset from each other at the beginning of a trial, and the subject uses a joystick to move the lines so that it looks like they are lined up with each other. If in fact they're not aligned with each other, but it looks like they are, so for example, the subject sets the lines like this and then says, okay, they look like they're in line with each other, that means that this eye is higher than this eye. And that way we're able to work backwards and figure out how much the eyes are misaligned with each other. And we do the same thing in the torsional direction with a line that moves like this. And they are able to do trials just one right after the other. It just takes a few seconds to get each one. So we're able to get a number of trials in each gravity level. We know that there is an asymmetry, even in normal individuals, between the otolith organs, the gravity sensors, on the two sides of the head. It's just a normal, inconsequential asymmetry that is normally compensated for as long as you're in a 1G environment. When you go into a different gravity environment, that asymmetry is no longer properly compensated, and one of the consequences of that is that the eyes can become misaligned. So they will either misalign vertically or they will misalign in the torsional or roll direction. And we have a rather clever way to make that measurement that is suitable for use in parabolic flight. We're already using some versions of this test in terrestrial applications. My colleague Michael Schubert is a vestibular therapist, physical therapist, specializing in rehabilitation of patients with vestibular problems. And this is turning out to be a useful tool in some cases to assess vestibular damage. He's looked at people in the military populations who have suffered blast damage, so vestibular injury to one side or the other. And other people have looked at sports injuries and how they impact this. There's also some evidence, and we have support for a different project that's related to this, that this asymmetry is related to space motion sickness. That's not what we're looking for here this week, but there is some indication from our other project that that could be related to motion sickness in space, and we're doing that on commercial space flights.